Hi, my name is Gaea Powell. I have watched the mammography business evolve into a disturbingly lucrative industry ever since my mother lost her life to breast cancer in 1991. I have never had a mammogram. I have always questioned the risks versus the benefits of mammography. Common sense told me that allowing a machine to compress my delicate breast tissue just didn't make good sense, especially if there was a tumor present. I certainly wasn't going to run the risk of having a tumor crushed, spreading the cancer. I also knew the fact that repeated radiation could potentially cause cancer. After seeing what my poor mother went through, I decided to decline my gynecologist's repeated attempts into talking me into having a mammogram. I have had a radiologist actually yell at me as though I were a child, insisting that I was at high risk and that I was a fool not to have a mammogram, basically trying to scare me into submission. Instead, it inspired me to become an advocate for a woman's right to know all of the facts and all of her options when it comes to her unique breast health. A new study published by the New England Journal of Medicine reignites the controversy that continues to plague the now faltering mammography industry. The study delivers yet another black eye by challenging the validity of mammography, putting the American College of Radiologists and others who have a vested interest in this multi-billion-dollar cancer industry on the defense once again. The study concluded that mammograms have little to no influence on the reduction of the number of women who will ultimately die of breast cancer. It also found that the risks far outweigh the benefits. The study reviewed 30 years of United States government data and found that as many as a third of the cancers detected by mammography may not have been life-threatening. More than 1 million women may have been overdiagnosed for breast cancer, exposing these poor women to the devastation of a breast cancer diagnosis that led to unnecessary treatments involving disfiguring surgeries, dangerous radiation, and chemotherapy. This new study follows on the heels of similar recent studies published by the Archives of Internal Medicine, the Lancet Review, the British Medical Journal, and the Nordic Cochrane Center. The United States Preventative Services Task Force and the Canadian Task Force on Preventative Care also downgraded their recommendations on mammography. The collective conclusion is that women should know all of the facts regarding the risks versus the benefits before even agreeing to have a mammogram. More and more women are considering some of the facts and are now declining mammograms. The facts are: mammography results are incorrect 80% of the time, providing either a false positive or a false negative. Repeated radiation can cause cancer. Significant compression of delicate breast tissue can also cause harm. Women are routinely sent for mammograms after discovering a lump on their own, though compressing a breast with a tumor present actually could spread the cancer. Mammograms are not effective for women with dense breast tissue or for women with implants. Mammograms can lead to overdiagnosis, as we mentioned before, and overtreatment. The overtreatment and overdiagnosis of DCIS and other abnormalities that would not have developed into invasive cancer. Overdiagnosis leads to surgery and possibility of radiation and chemotherapy treatment. Mammograms also cause considerable psychological stress and anxiety. Mammograms are now also leading to the disturbing practice of preventative mastectomies. A double mastectomy is a major operation with many potential risks and unforeseen long-term effects, without a guarantee that a woman will remain cancer-free. Fortunately, the new studies have confirmed concerns that many ridiculed skeptics have been voicing for years. These new studies are empowering women to question their doctors and demand answers. Ladies are refusing to be bullied into having a mammogram, keeping the mammography industry on the ropes. They are following the United States Preventative Services recommendations and are now insisting that their gynecologists and radiologists respect a woman's personal values and their fundamental right to choose the option that is best for them. After decades of tireless efforts by progressive doctors and scientists and concerned citizens, A new paradigm on how we look at breast cancer prevention, screening options, and treatments is finally emerging, allowing women to be proactive in their healthcare choices and helping them realize that doctors do not have all the answers. Breast density laws have now been passed in California, Connecticut, New York, Virginia, and Texas, making it mandatory for a radiologist to inform their patients who have dense breast tissue that mammograms are basically useless for them. That is 40 to 50% of women. Dense breast tissue and cancer both appear white on an X-ray, making it nearly impossible for a radiologist to detect cancer in these women. Thankfully, the law is now being considered at a federal level as well. Radiologists in general are not the enemy. They rely on what they learned in medical school, and most follow what is dictated by the American College of Radiology, the American Medical Association, and the FDA. There are many progressive radiologists who already provide density information to their patients and encourage them to utilize other technology options. Unfortunately, the majority of radiologists have kept this potentially life-saving information from women for decades, and our government agencies have failed to protect us from this unethical practice. Most women trust their radiologists are providing them with all of their data. It is unbelievable that this invaluable information has been withheld from women all these years, information that has cost some women their lives. After my mother died at the age of 49, I was not impressed with the path mainstream medicine was on, and sadly not much has changed, except for the fact that the industry has evolved into a tight-knit business model making billions of dollars annually. I decided to take a different path and avoid the rabbit hole some doctors lead their patients down. I continue to research all of my options, and I take responsibility for my own whole health, which obviously includes my breasts, being that my breasts are not separate entities as some would have us believe. I hope this information has been helpful. Be your own health advocate and be well.